How can kinesio taping help cold weather ailments during the winter months? Hi, I'm Dr. Michael Lee. I'm one of the certified kinesio taping instructors here in the UK. Thank you so much for joining me. If you're a physio, a chiropractor, an osteopath, or even a sports therapist, or even a student. And I want to do, before I start, I want to give a massive big shout out for the students that completed the fundamentals training last weekend on Saturday and Sunday. So thank you so much for joining us, and I hope that you learned so much about kinesio taping, especially that it can help so many problems that where so many collisions just get stuck and I'm not sure what to do, and kinesio tape can be the answer. So let's just get into the roots of this and find out, okay, how can kinesio taping actually help with cold weather ailments? So let's talk about the cold weather ailments first. What can they be? So cold weather ailments, we're talking about like Raynaud's is one of them. So again, cold hands, cold feet. We're talking about stiffness. We're talking, what else? We're talking about they may be getting, people are not warming up well enough, so they might be getting a lot of stiffness in their muscles as well. They may be thinking about breathing as well. You know, when it's really cold, it can be quite difficult to breathe. So the question is, how can kinesio tape actually help with one of these or all of these things? Well, the truth of the matter is that Dr. Kinesio Taping, he actually created, a part of his philosophy is, one of them is called space. How to create space in the body. And he's not thinking, how do we manipulate things? How do we massage things? How do we move things? He's about, how do we create space so actually the body can just do what it's supposed to do? How can it move fluids around? So we're talking about fluid dynamics here. We've got like blood, we have water, we have all these lymphatic system, we have all these things that are moving around, right? And the question is that he's thinking, what can we create? How do we create space so all of these mechanisms can work? Because let's be honest here, Raynaud's, where it's coldness in the feet, why is it just the feet? So the question is it just circulation? You could say weak heart, maybe. Unlikely though. It's probably because something is compressing just above the feet that's preventing the fluid to get back, right? Preventing the blood to get to there. That's why they get coldness. If we're thinking about when people get stiffness in their joints, because essentially the lubrication in the joints isn't actually working normally. And there are two things that could be happening there. Firstly, is it the lubrications, the viscosity of the synovial fluid or lubricant is that it's not actually, you could say, viscous enough, and that's what's causing the stiffness. So it needs to increase the temperature to allow it to become a bit more liquid. Or the question is it because it's so stiff and naturally things are so compressed that actually it's not allow fluid to get there to allow the muscles to contract better or the ligaments to actually move better. That's why we do a warm-up, right? That's what we're talking about. What if we get stiffness in our muscles? That we need to warm our bodies up to get more temperature, to get more blood, to get more oxygen, to get more nutrition to the muscles so that they can operate normally too. So then the question is that, how does kinesio taping even do this? How can it help? Because when we apply tape onto the skin, and what happens is that the elastic fibers of the tape, it is lifting. And when it's lifting, we call the epidermal, the dermal layer, so it can lift it up. Everything below now has more space to move. Right? So you got your fascia, you got your muscles, you got your lymph systems, you got blood. Things can move better because the tape is lifted. So this is the thing with kinesio. If we know there are restrictions in our body, if we know that there are things that are preventing fluid to move in those areas, then we know we can apply kinesio tape at the right tension and also the right direction. And kinesio tape is the original taping method, and it's the only one that actually looks at direction. And direction is really important because that can actually change how the body actually functions. When we apply the tape on, it lifts in the right direction. It's going to encourage fluid to move towards that direction as well. So this is one of the things that I can, okay, we'll talk about breathing, cold weather breathing. You think when there's a reaction with the coldness, how can you apply tape to, again, create space for the lungs to expand? So this is one of the beautiful things about, particularly when we're coming into December, it's a winter now, that kinesio tape can actually still be beneficial for a lot of people. Because just think, if we allow more space, more nutrition, more oxygen, more blood to get in those areas, is it going to be functioning better? of course it's going to be functioning better. That's why we can apply Kinesio Tape to help with these types of ailments. And we have other ailments in terms of when it's cold as well, what do people actually struggle with. So you can actually think about illnesses as well. So we're thinking about if there's illness, say they've got colds or flus, they might feel congested. Congestion is we need more space to allow all of the mucus or the sputum to actually move out as well. And sometimes you can put tape on these areas to actually create that space inside the sinuses too. So I really hope that you found that you probably think it's widening your thought in terms of what can kinesio taping do? Because I'll be very honest with you, because we've been doing it for almost 20 years now, is that kinesio tape, the list just goes on. Because not only is it affecting things structurally, it affects things neurologically too. So if you ever feel that something's not working in a patient's body, or you think, I'm not sure what to do, kinesio taping could be the answer. So if you have any questions about cold weather ailments and winter and kinesio, just put them in the chat. We're happy to help you. But I just wanted to let you know, if you want to get more information, you're thinking about, I've got a patient with chronic pain, I've got patients with lymphedema, I've got patients with, they're getting weaknesses and instability, and it doesn't matter how many exercises I throw at them, it still feels weak and unstable. Or it might be even you as a therapist. Well, kinesio taping can be the answer to all of those questions. So if you're interested in our next intake for the Fundamentals Kinesio Taping course, the live event is happening very, very soon. If that's you, just put me into the chat and one of our advisors will contact you and let you know what's happening, where it's going to be, because we are going to be dotting all around the country just so that we can serve you. So we need to make sure we have the right one in your location, of course. But if you're interested as well, just again give us a hello, and we'll probably ask you if you want to learn it, which part of the country are you, and we'll try and do our very best to organize a live training there to help you as well. So thank you so much for joining me today. If you have questions, let me know. Other than that, have a lovely rest of the week, stay warm, and look forward to seeing you next week. Bye for now.